am Dr. D. Vijayarani, Associate Professor and Head, Department of Home Science, V. Vaniparmal College for Women, Virudunagar. In the last video, we discussed about what is children with special needs, how can we classify it, what do you mean by gifted children, who are physically handicapped children, meaning of those things, causes, characteristics, prevention and care we discussed. Now in this video, we will see about mentally handicapped children. Before, we call these people as mentally handicapped children, but in modern times, we call them as intellectually disabled children. Who are mentally handicapped or intellectually disabled children? I hope in the last video I told you what is IQ. What do you mean by IQ? IQ is nothing but intelligent quotient. It is used to measure the intelligence level of a normal person. What is the normal IQ of a person? That is 90 to 110. Yes. When a child has less than this 90 to 110, they are only called as mentally handicapped children. Okay. Now let's see the definition for it. It is characterized by significantly sub-average, not average, below that. So, sub-average intellectual functioning. They may have the limitations in one or two of the following adaptive skills. For example, either they may have problem in communication or self-care, or they might feel difficult to adjust with the home living, social skills, community use, self-direction, health and safety, functional academics, leisure and work. So, in all these areas, these mentally handicapped children, they may have either two or more than two deficit in these adaptive skills. So, it is characterized by significantly sub-average intellectual functioning. Okay. What are the characteristics of these children, mentally disabled children? Inability to acquire necessary motor skills. They might be slow in, suppose the child, normal child, when they walk at the age of 8 or 9 months to 1 year, means these children, they may delay in that. They may delay in normal motor skills. Normally when the child talks, means these children, they may delay in talking also. They may have trouble in speaking also. And they don't know how to pay for anything. They may not be in a position to, how to pay the amount for what they have got in a market or something. And they have trouble in seeing the consequences of their actions. Like for example, even when they have matchbox in their hand, when they light it, they don't know the effect of that. That may get burnt and all, they don't know. Just when the fire is there, means just they simply see that, they don't know the consequences of it. Even when the snake goes nearby them, they don't realize the consequence of biting that snake. And they have trouble in understanding the social rules. Usually we walk by the left side, and other rules they may follow whenever we walk in the roadside, or when we come out of the home we follow some rules. That and all they may not be knowing. And they have trouble in solving many of the problems. Any problem, whatever they face, even for eating or when they come out for anything, or inside the home itself, if they face any problem in getting a tumbler of water, anything, they have a problem in solving any of the problem. And they find difficult to remember things, like a child only. Because of the low IQ, they feel difficult to, only that the brain structure may not be normal, and they don't understand the life situations. Suppose when they want to go to the restroom means, that also they don't know. They may pass the urine the place where they are. So like that, they don't know the life situations. They don't understand the life situations. And moreover, these people, they may have lesser lifespan. They don't live longer. And they feel difficult to adjust with others, poor social adjustment. They don't interact that much with even with the same age group or with the elders or youngsters, whoever that might be. They feel difficult to adjust with those people. And their attention span is also very less. Like kids only they may have. They can't concentrate on anything. They don't listen anything. Their attention span is very, very less. So these are the characteristics of mentally handicapped children. How do you classify it? Actually, slow learners, mildly retarded, moderately retarded, severely retarded and profoundly retarded. So like this, these children are classified. Among all these, the slow learners, they can accustom into the normal classroom. Other children, they may not go and attend along with normal children in a normal school. They need special schools. Okay. Who are the slow learners? They are like, I told you, slow learners, they can be in the normal classroom, like with the normal children. They are called borderline deficiency children. They can mingle with the normal children, but they feel difficult to learn. Like extra attention must be given to these children by the teacher and by the parents so that they can come up well. Next category is called as mildly retarded children. What is the normal, like I told you, 90 to 110. So these children, they have less than that, that is 50 to 70 only. So because of that, they show immature behavior. They don't know how to behave in a classroom or in a home or in an institute, wherever they might be put up. But they know self-supportive skills, like they know a few words, they can communicate. They know this avoidance of danger, like when burns, that time they feel it's a danger and they can take care of themselves. They know the vocational skills, like we can make them to learn toy making, carpet weaving, basket making, that and all they may do. So we can provide vocational training to these mildly retarded children. Okay. The next type is moderately retarded children. Look at this, when you compare to the previous one, 50 to 70 IQ, but this one is lesser than that, that is 39 to 45 only. But these children, they are called as trainable mentally handicapped children. We can train them, right? They can take care of their body needs. They have limited vocabulary only. They may not in a position to communicate that much, but they can learn simple social adjustments with the others. Severely retarded children. See, these children, they may have IQ of 20 to 34. They need assistance in physical care. That means even for feeding, going to the toilet, for everything they need somebody, some help is needed for them to provide the physical care. I told you, these children, they cannot go to normal school. Physical disabilities also will be there. Speech retardation also will be there for these children. Profoundly retarded children. IQ might be less than below 20. So they need continuous help and supervision is needed. If at all supervision is not there, means something they may misbehave. Growth is also, physical growth is also retarded. Poor muscular coordination. They may have speech defects. They may not be in a position to adjust with others. So they have less vocabulary, so poor communication. Now we'll see what are the causes for this mentally handicap or intellectual disability. why they don't have normal IQ like others? What are the causes for it? Number of causes, one among them is phenylketonuria, that is error of amino acid metabolism. Galactosemia, that is low or sometimes high galactose level or both. So, inability to metabolize galactose. Cretinism, I hope all of you know that, deficiency of thyroid hormone. Consanguineous marriage, that is getting married with the close relatives. That's why nowadays we don't allow getting married with the maternal uncle and all. Chromosomal anomalies. This nowadays, even in the pregnancy period itself, we are doing that scanning and chromosomal anomalies are found out. Environment factors, number of factors are there. So, unknowingly, they may get this because of the environmental factors. Not only that, prenatal causes. That means, during the pregnancy time, sometimes physical trauma or nowadays we expect the pregnant women to eat balanced diet. Suppose when they don't eat that also, that may lead sometimes infection, blood incompatibility, RH factors, radioactivity, toxic agents, anoxia, that is due to lack of oxygen, hydrocephaly, brain damage, microcephaly. Not only that, during that period, pregnancy period, natal causes, prematurity, suppose when the child borns before 10 months itself, so they are susceptible to this prematurity, traumatic birth injury, anoxia, and the postnatal causes that includes head injuries. That's why we must be very careful in bringing up the kids. They should not fall down. Nowadays, that cap and all, it's available, so that even though if the kid falls down, that might be protected from this head injuries, infection, frequent high fever. Whenever the child gets fever, that must be taken care well immediately. Malnutrition and also lead poisoning. So, how to prevent that? How to prevent intellectual disability? First thing, no consanguineous marriage. We should get married other than close relatives. So, care must be given during the pregnancy time. After that also, as soon as the baby is born, sometimes people won't take care that much. But after birth also, the child must be taken care well. Clear direction and encouragement. The supervisor or the teacher or the parent, they must give correct direction, and we should encourage these children well. And we should provide learning atmosphere, and that must be, explanation must be very simple, and concrete examples must be given so that they can understand better. Vocational training, it's very, very essential for them so that they might be engaged. Lastly, supervision must be proper, and that must be given to each and every child. Suppose if you can't supervise that child by yourself, means some arrangement must be made, or otherwise these children must be institutionalized so that they may take care well. I hope you have all understood the meaning, causes, classification, and how to prevent mentally handicapped. Thank you.